diagram visually compares four major types of observational study designs in clinical research: cross-sectional, case control, retrospective cohort, and prospective cohort studies. It maps how each study type relates to time, specifically the past, present, and future, and highlights the direction of analysis and comparison group. 1. Cross-sectional study, leftmost column. Time focus, present, what it does. Compares disease prevalence across individuals with and without a risk factor. Example question: do people who currently smoke have more chronic cough than those who don't? Key point: snapshot in time. Cannot determine causality or timing. What came first? Shot 2. Case control study. Time focus. Starts in present, looks into the past. What it does. Starts with two groups: people with disease, cases, and without disease, controls. Looks back in time to compare how often each group was exposed to a risk factor. Example question: were people with lung cancer more likely to have smoked in the past? Key point: efficient for rare diseases. Measures odds ratio OR. 3. Retrospective cohort study. Time focus. Starts in present, looks into the past to identify exposure, then compares outcomes. What it does: selects individuals based on past exposure from records, then compares disease incidence between exposed and unexposed groups. Example: reviewing old medical records to see if patients who used a certain drug developed heart disease more often than those who didn't. Key point: measures relative risk RR. Exposure precedes disease even though analysis is retrospective. 4. Prospective cohort study. Time focus. Present, future. What it does: starts with a group of exposed and unexposed individuals, follows them forward in time to see who develops disease. Example: following smokers and non-smokers for 10 years to see who develops COPD. Key point: measures relative risk RR, stronger evidence than retrospective designs for causality. Summary table. Based on diagram. Study type, starts with, looks at time direction, measures, cross-sectional everyone, disease and risk, present, prevalence, case control, disease status, past exposures, present, odds ratio, retrospective cohort, exposure status, past plus disease, pres relative risk, prospective cohort, exposure status, future disease, present future, relative risk.